guys. Let's talk. Okay, so one of the last patients I saw before I stepped away from this service, yes, I did. I had to. One of the issues that we see a lot of people asking questions about is excessive bleeding. We see that all the time, right? But what about the people who aren't bleeding, right? So there should be only two reasons that you are not having a period that we're okay with. Let me say. Number one would be if you were on birth control and the birth control thinned out your uterine lining enough to where you weren't having a period because there was nothing to slough off, right? And number two would be if you were in menopause. We'd be okay with that, right? Actually, if you were in menopause and you started bleeding, we would be very concerned. So if that's happening, please see a doctor. Thank you. No, but seriously, yeah, you should see a doctor if that's happening. If you're in menopause and you are bleeding, that's a problem. And when I say in menopause, that the definition of that means that you have not had a period for a complete year. Okay, a whole year, not 11 months and 3 days, like an entire year, and you didn't have a period happening, and all of a sudden you started bleeding. Yeah, you should see a doctor. But that's not what I'm talking about, right? I'm not talking about those two things. What I'm talking about is like people who should be having a period every month and are not having a period. That's problematic. That's questionable, right? So when we have a period, we're going to talk about this. This is our uterus, right? Our uterus is connected to our vaginal canal. This is the same hole that the pee-pee goes into, right? So this is our uterus. Now every month we're supposed to have buildup. We build up a wall. We build up fluff in the wall. This is the cushy stuff that egg likes to burrow down into and start building a baby if it's fertilized, right? If it's fertilized. But yeah, all it is building up. Now, at the end of our month, when we're about to have a period, all of that just rips off of the walls and it comes down and it's blood and guts and all that other stuff that we like when you sneeze and that. Yeah, you get the picture. But all of that comes out, right? And that's supposed to happen every month. Now, if it doesn't happen every month and all of this sits in here and it continues to build up and it just keeps going and it keeps going, that's not good. That puts you at risk for uterine cancer. So this is why, when we see you, like I had a patient, she came in and we were talking and I was like, oh, okay, when was your last period, And she told me that it was like months ago. I was like, that's not okay. And she was like, oh, I thought it was fine because I haven't bled in months, and she was happy to not have a period. And I know, and it's a glorious life. I get it. I do. But that's not okay. That's not okay, right? So if we're going more than 28 to 31 days, no, we can give it 35, right? If we're like way off of that, if we're going like 2 months, 3 months, and we are not having a period, that's not okay. We should see a doctor. We should probably get some progesterone, something called a progesterone challenge. I think I talked about this in another video, maybe, where the doctor gives you 10 days of low dose progesterone, almost like a ramp up, and then you pull it away. You stop taking that progesterone and you should have a period. And some people, most people, will have a period before the progesterone, the 10 days are up. And then like you can take it for 3 days. And then if you have some type of bleeding, you can stop taking it. You don't have to take it for the full 10 days. You're just trying to jumpstart some type of bleeding because your uterine lining needs to shed. All of that can't stay in there. That's not supposed to stay in there. We are fine if you're taking birth control. If you take a lot of people who are taking birth control continuously or are taking the birth control that just thins out your uterine lining or have an IUD in there, that's fine. We know what's causing it. We understand that nothing's growing in there and that's why you're not bleeding. That's okay. Another solution that they might bring up is you actually using birth control to at least control the growth of that uterine lining, right? To kind of keep it low so that at least we know that it's low and that you're not growing anything and it's not that those cells are just sitting inside of your uterus and aren't doing anything and slowly becoming cancer, right? So that's also an option. This problem we see a lot in our overweight women. So women with PCOS as well, which also goes hand in hand, because some of that weight gain and some of that not being able to lose weight could end up being a symptom of PCOS, though it runs on the spectrum and not everybody's the same. So keep that in mind. But yeah, adipose tissue, so fat cells, have a correlation with estrogen. There's a relationship there. So keep that in mind, right? So that disrupts things. And so when we look at those cells that are sitting inside the uterus, please, if y'all not having a period, and you know you're not on birth control, and you know that this is not menopause, ask somebody to take a look inside and make sure and see and what is causing that, or draw some labs or something. We need somebody to check some hormone levels. Okay, we need to see what's what and where, at what time too, because where you are in your cycle is also important. But if you're not having a cycle, that's problematic too, because we can't tell where you are in your cycle sometimes. So get that taken care of. If you're just on your own, you going month to month or whatever, and whatever amount of time, and that's not supposed to happen. Please see somebody. It's not okay. Okay? All right. Questions, comments, concerns? Thanks for coming to my TED Talk. Love you. Bye.